The NIH is the crown jewel of American biomedical sciences with a long and illustrious history of supporting breakthroughs in biology and medicine. I have the utmost respect for the NIH scientists and staff over the decades who have contributed to this success.
One thing that's been a real topic has been the issue of measles vaccines and autism. And we can see that the false article in Lancet decades ago has led to a lot of people not getting their child vaccinated. There's now a child who died from a vaccine-preventable disease in Texas. Let me repeat that, a child who died from a vaccine-preventable disease in Texas. The secretary has put out an editorial, which is, if you just read it, the kind of understanding of it is that you should get vaccinated. I've been told that you have said that we need to invest NIH resources at looking at the link, a possible link between measles vaccine and autism. I've not heard that directly, it's hearsay. Any comment on that?
Senator, it's a tragedy that a child would die from a vaccine-preventable disease. I fully support children being vaccinated for diseases like measles that can be prevented with the vaccination efforts. As far as research on autism and vaccines, I don't generally believe that there is a link, and based on my reading of the literature. But what I have seen is that there's tremendous distrust in medicine and science coming out of the pandemic. And we do have, as you know, Senator, a sharp rise in autism rates in this country. And I don't know, and I don't think any scientist really knows the cause of it. So I would support an agenda of a broad agenda, broad scientific agenda based on data to get an answer to that.
But this has been fairly well, in fact, it's been exhaustively studied. And there's limited resources. And if we keep plowing over ground that has been plowed over, knowing you can never prove a negative, and since we don't know the cause, we'll still have a problem. We've got a responsibility with limited resources.
We've had grant freezes, pauses on advisory meetings, pauses on clinical trials, mass firings being carried out by the so-called DOJ, and it is really threatening our ability to treat childhood cancer, to mitigate the effects of Alzheimer's disease and other forms of dementia, and to better understand and treat women's health issues. Do you support the recent researcher firings and grant freezes that have been implemented by Trump and DOJ?
Senator, I was not involved in those decisions. If confirmed as NIH director, I fully commit to making sure that all the scientists at the NIH and the scientists that the NIH supports have the resources they need to meet the mission of the NIH, which is to do research to make America healthy. So
do you support further cuts at NIH funding or staff?
Senator, I don't support. I don't have any intention to cut anyone at the NIH. If I've been confirmed as director.
Know about all the grant freezes and the pauses on all the advisory committee meetings, all the pauses that are now in effect on clinical trials that are happening there right now?
So, Senator, I've read the press accounts of it. It's hard to know outside. I've not interacted with people in the agency.
If you're confirmed day one, what will you do about that?
Senator, I'm going to assess it as day one. I'm going to understand what resources the whole NIH needs.
I know you have been such an advocate of how we led in Florida, the things we did. As you remember, when I was AG, we opened our schools right back up right away. We were sued by a teachers union. And everything from how we dealt with masks to social distancing to the vaccines, there were misrepresentations abound during this time. And so I want to talk to you about how your opinion on how Florida handled that and how you think that might translate into your new role. Do you feel like your views and scientific opinions might have been disregarded or set aside in pursuit of some government narrative?
I'm tremendously proud to have been involved in advising the Florida response to the pandemic. One of the things, I was actually involved in the case that resulted in the Florida kids being able to go back to school. So even as my kids were left out of school, basically not allowed to go back into the school buildings for a year and a half, the kids of Florida were allowed, and as a result, the results are so much better. Florida has a lower all-cause excess death rate during the pandemic than California did. So I think Florida's response to the pandemic was tremendous success. But I'm really glad you highlighted the role of censorship and restriction of scientific discussion. And I commit to making sure, in fact, it's one of the 5 points I emphasized in my opening statement, that we have allow a culture of dissent and respectful conversation about scientific matters rooted in data at the NIH.
Okay, just want to ask you about one other area of concern. It is no secret that this administration feels absolutely triggered by any mention of equality, any mention of inclusion, and the president himself, in his own words last night, essentially said America intends to erase any reference whatsoever to race or gender. Having said that, I'd like to refer to a study that you co-authored called Persistent Racial Disparities in Survival Following Heart Transplantation, and to ask you whether or not, because I understand there are some watch lists that have been created, whether you believe that on the basis of this study, should that work be placed on a DEI watch list because it references racial disparities?
Senator, I'm not aware of any watch lists. I don't intend to implement any watch lists. I will say this, that the health needs of the minority populations in this country are a vital priority for me. In fact, the health needs of every single American are a vital priority for me. I want to make sure that the research that the NIH does addresses those health needs. And I don't see anything in the president's orders that contradict that. In fact, quite the contrary. What I've heard from the secretary and from the president is let's make America healthy, meaning all Americans.
Yeah, I know. I don't want to be naive, though. He did mention that it is absolutely triggered.
The letters terminated funding for these studies, stating, quote, "The premise of the grant is incompatible with NIH priorities because the study explicitly included LGBTQ people. And without this funding, grant recipients will now be forced to stop research to address the mental health crisis and Alzheimer's disease. People who have committed their lives, doctor, to these efforts will lose their jobs. By unanimous consent, I submit these letters for the record, Mr. Chairman.
Without objection.
Doctor, in your testimony, you stated that you want to encourage free speech and dissent among scientists. In the spirit of free speech and dissent, will you commit here today to object to any decision made by Donald Trump, Elon Musk, or Robert F. Kennedy that would slow or stop life-saving research?
Senator, I'm not involved in the decisions of the NIH up to now. If I'm confirmed, my commitment is to make sure that all the scientists at the NIH and all the scientists that receive funding from the NIH have the resources they need to do their life-saving research.
Will you object if it slows or stops life-saving research?
Senator, my interactions with Secretary Kennedy and President Trump to date suggest that they don't want to slow research. They want to speed it up.
So will you object if that becomes evident that they're slowing the research?
Senator, I have to say I don't believe that they are ever going to ask me to do that. I think they're committed to innovation and research.
Will you commit here today to reinstating funding for scientists whose funding has been terminated because their research does not align with MAGA ideology?
Senator, I don't believe that ideology ought to determine whether one gets research or not. I believe very fundamentally in wide diversity
funding
of
research on the mental health conditions of the LGBTQ community, that should not be a basis for canceling funding for research. Is that what you're saying?
Senator, I'd have to look. If I'm confirmed, I'll absolutely will go look at the letters submitted for the record, so I can go look. But if confirmed, I'll go look carefully into that. I want to make sure that the processes that the NIH has
I appreciate that.